Welcome to Taking Charge of My Cancer, episode 8. I am Derly Munoz, your host, and I'm so excited to have a very special guest today. We have one of our guests today is Reena, Arndt. Reena has been married for 33 years. Her husband, Tom, and her have 2 children, 31 and 29. She has been a pharmacist for 34 years. And she loved to be a community pharmacist, loved meeting people where they are from a young age, and she has been drawn to taking care of people in need. Her passion has turned into educating people about taking care of themselves. She recently got certified in Anti-aging and Regenerative Medicine. She considers herself an integrative medicine pharmacist. She believes when the traditions and knowledge of the Eastern medicine meet the science and that of current day medicine, we can truly care for our own bodies. She gets so excited to learn information that she can bring to her patients to improve their quality of life, and truly is all about quality of life. She had also learned personally that it is so hard to be consistent, and that having a person that they can say, hey, let's start here and move forward one step at a time makes all the difference. She likes to tailor a plan that works for each individual. That is what meeting people they are is all about her. It is considering the time, cost, and commitment and seeing it from the other side. So, Reena, thank you so much for being here. And you actually has been so helpful to me. And then we will talk a little bit more about that in a second. So again, thank you for being here today.
Thank you for having me, Darley. This is very exciting.
Absolutely. So you want to tell us about your business, your mission? How do you end up here?
Well, as you said, I've been a pharmacist for 34 years, always working. I started in hospital, but I ended up in a community type of setting out in the world, Publix, that type of setting, and then a specialty compounding pharmacy, etc. I loved being a pharmacist. And when I decided about a year and a half ago to leave the pharmacy setting because I wanted something more. I wanted to really, the pandemic had happened. We were in the middle of that, and I missed being able to connect with patients. So actually a patient of mine went to great lengths to find me and text me and say, okay, we need you. You're not done. So I decided to start my consultant pharmacist business, which is called WellnessPharmD. Weird name, I know, but I wanted to incorporate the fact that I was a pharmacist and wellness really matters to me. So I kind of put the 2 words together. So WellnessPharmD. That is my business, and that's what I love to do.
That's awesome. That's awesome. Were you ever planning to do this, like just being a pharmacist to begin with?
So, as any young girl, my parents, having immigrated from another country, from India, actually, they wanted me to be a doctor. That's what every Indian parent wants for their child, a doctor. Something just didn't seem right. And I came upon the profession of pharmacy. And I love it because I get to do a little bit of both. And I feel like I can stretch my hand and touch the patient just as much as a doctor does, yet spend more time with them. So no, I didn't plan on pharmacy. I definitely did not plan on the business. It is something that came out of an unexpected and a difficult turn in my life. And I had to make a decision. And as my first patient that made me think about starting the business said, I wasn't done taking care of patients. I wasn't done learning. And hence grew the consultant pharmacist business.
That's awesome. That's awesome. Would you like to tell me a little bit more about what is this like integrative medicine pharmacist? Like that was totally news to me when I saw that. I was like, oh, this is really a new concept to me.
Right. So, when we think about integrative physicians, integrative healthcare, we are thinking about the whole patient. How I think about it is I still love being in a pharmacy dispensing medications. But what I realize is that the business of pharmacy itself doesn't give too much time either to the patient or the pharmacist and kind of checking in with each other and saying, hey, this medication, this is what you can expect. We pharmacists are trained to do that, but then to go to the next step and say, but this is what you can do to manage that, because sometimes medicine is needed, prescriptions are needed, but yet patients don't necessarily understand why or what to do with side effects or how they can augment the effects of the medications, right? There are a lot of things we can do that kind of help the medications do a better job even. So it's integrative pharmacy, medicine and pharmacy to me. And I think I don't think I coined the term, definitely, but I know I use it now because I don't just look at what I'm dispensing or what a patient's number is. I look at the whole patient, including how does the patient look? How is their color? How does their hair look? Are they smiling? What do their eyes look like? So I can, I want to look at the whole patient and treat the whole patient.
And that's amazing. Again, independently with now you're so looking with a completely eyes a patient, but sometimes when I come across with some of the patients is, you go to the pharmacy and you come with a prescription and they end up with all these medications that sadly some of the pharmacies don't look at the whole picture and they just keep dispensing stuff, right? Because that's what the doctor prescribed.
Mm-hmm.
And then it's like when they come to us and they have this huge list of medications, it's like, wait a minute, why are you taking 3 things for pain? What are you taking 2 things or 3 things for blood pressure or whatever?
Right.
And like, have you ever bring all your list of medications to your doctor and say, hey, somebody better pay attention to all these because they have multiple physicians who will prescribe multiple things.
Right.
And they just land on the pharmacy and they just pick everything up and they just take everything, right? So
Yeah.
it
And
is.
I also came to the because I love what I do as a pharmacist, I realized the pharmacy, we had kind of taken the personal, because I graduated at a time where you still went to the mom and pop, which, that's not what our world is, but it's made patients kind of not look at pharmacists as true healthcare providers. And I want to change that because pharmacists can offer a lot
Mhm.
in different areas. So I also wanted to bring that to the forefront with
Okay,
this business.
awesome. Will you give us 3 valuable tips that you have learned about your journey that can be benefit to our patients?
Yeah, definitely the best. I would say the foremost, and this was a hard lesson to learn, is that even in the depths of the worst of things that you may be going through, that I had to go through to get to this business, as an example, um, you have to look for that. You have to look for that can elevate you just a little bit and go, okay, this is the next step, and then take the next step. So um, even the worst of things, there's a time frame as far as I'm concerned, in the sense that you have to grieve, you have to give yourself that opportunity, but then make something of that. That I would say is the first lesson that I've learned. The second is you have to be flexible. I never in my wildest dreams imagined this, including talking to you today. It is so ironic that, I am, because I just finished this course in anti-aging and regenerative medicine and took the board exam, passed the board exam. So I'm trying to really
Congratulations.
thank you, wellness. So yeah, so be flexible. And I would say the third thing is to really look at, as a pharmacist, it's easy to go, oh, that's the next prescription or whatever. But I really learned, I never, even now, I don't, 34 years later, I look at that person in front of me as a patient and as a fellow human on this journey. And I think as long as I do that,
That's awesome.
I can help.
Excellent. That's awesome. How about your most painful lesson?
Painful lesson is that just because it's my dream and my vision doesn't mean everybody else is going to jump on board. Um, because it is my vision, it is my dream, and it's going to take a hard work. And it don't put it in a box, because I did in the beginning. I had goals, and I thought, oh, I'm a good pharmacist. Everybody is going to get on board. So that was, even friends and family, they look at me and, but that's okay. Just being able to say, it's my dream, it's my vision, let me take it out into the world. But that was a painful lesson to learn.
Okay, that's awesome. Um, is anything that you have that will be a value for our audience, and will you share with us?
I think in this arena where you are working, there is a lot of up and coming information and data coming up. I think we already have a lot of data. We just don't, most of the time patients don't have the time to go look for that, right? And as a matter of fact, the course that I just did, I learned so much about treatment, as far as how, as healthcare providers, we can have a supportive role, in cancer treatment, and walking the steps with them. I think there is so much information on stress, how it relates, how that inflammatory process can have such an effect on our healing. And there's information as to how to mitigate that, not just, whether it's yoga or walking, or but there are things that we can do, nutraceuticals that are available, good ones, to help with all that process internally. So I do think that's something that that I would love to be able to help with, and that I think I can.
Awesome. And you actually brought a really good point. As I'm doing this day in, day out, and what I see, one of the most painful of frustrations for a lot of patients who are dealing with cancer is that fear, right? And with the fear comes a lot of stress. And with the stress comes a lot of sleepless nights. And with that, we know that a lot of our breast cancer patients will have to have some type of hormone blockers. And we know what that means, when hormones are being blocked and your estrogen and your progesterone goes down. Even I've been learning from you about even testosterone levels going down, how much our body and mind just have to really take a toll on kind of learning how to now be without those. And so I think it's super great that you're able to, kind of like give them some information about, so many things out there with supplements and being natural that can be so helpful. Even for those who are in some of kind of hormone blockers, and we know they cannot take estrogen or progesterone, but what else can be done to get that whole quality life to improve? Because this is a journey, right? And it's a journey that for some of the patients maybe is a non-end journey, right? Because you always be a cancer survivor. You always be that next year milestone, the next time that you have the test, and the next time you go do your mammogram, or just seeing your follow-up. And then you do that for 5-10 years, and then it's like, now what do I do after that, right? Who do I go see? Who is going to continue being my coach if I continue having some issues with this? So sometimes we kind of feel like, you need that help. throughout your whole life, because every year after year is a reminder of me. A year ago I was diagnosed, 2 years ago I was diagnosed. So it's super valuable. So I'm so glad that you're here. And that was the first thing I thought about, like was thinking about you and how much of that information can really help our patients. So
Thank you. Thank you. It's true. It's very true.
So how can people find you?
I actually have a website called WellnessPharmD, WellnessPharmD, no spaces in between. There is, I think, another, I don't know what it is, but it has spaces in between.
That's
But
okay. And I usually will put it on the podcast, so they'll have that information in there.
I'm on Facebook. I am not a huge fan of social media. I shouldn't say that, but it's not that I don't have the time to really devote to it. I feel like I need a second Reena to do that, right? But I have gotten some help, and they will be helping more. I'm trying to get an Instagram. Well, I have an Instagram account, but I'm trying to, so that's available. I can always be reached by you have that information, my email or my phone. My phone is my business phone. That being said, I do get robocalls just like everyone. So lots of times I tell friends that are referring other people, tell the patient to text me or email me, and then I will know it's someone that I need to respond right away. Okay. And that's what I do. Okay,
perfect. What about 3 books that you will recommend for our audience?
Oh, it's so funny. This when you think about it. So I am a person that really looks inward a lot, and really thinks about why our bodies are doing what it does, or why our minds are doing what it does. And one of the other things that I am passionate about is our mental health. And the pandemic has even made that in the forefront, right? So one of my favorite books is The Alchemist. So I don't know, people are probably going to go, what is she talking about? But anyway, it's by Paulo Coelho, Cohello.
Okay.
It's about this young boy, Santiago, looking for treasure, going from, traveling from Spain to the Middle East, looking for the treasure. But in the end, learning that the treasure was within himself. So I love books like that. Anything to do with the heart. Another one is called Unbinding the Heart. It is by, I am going to say her last name wrong. She's Greek. Agape is her first name. Her last name is Stasinopoulos.
That's very close. Okay.
But it truly is about how our heart, when we keep it bound, whether it is, the hurt or whatever it is, then it affects the mind and the body also, and how the heart can be the beginning of healing also. Even taking all the medications, we need more. We need inner healing. So the other book that actually that I am right now, I am in the process of reading that, but every page it's like, oh my gosh, why did I not read this 30 years ago? It is called The Seed of the Soul. And the reason I started reading it is because I was watching Super Soul Sunday, Oprah Winfrey's show, and she was talking about it. The author is Gary Zukav, Z-U-K-V, I think. So those are the 3 books right now that I am just, I would say that I would recommend to everyone.
Great. Thank you. How about movies?
I am not, so I never watched, movies were not a thing growing up in my house. So movies came about as I had children. And so the one movie that I remember from my teenage years that I love, or 20s, that I love is Steel Magnolias. Everybody.
Oh, yes.
Yeah. Believe it or not, the other movie that I walk around thinking about singing tunes to all the time, uh, it's because of the impact my children and my love for them and my little family. It's The Lion King, the
Oh, okay.
story, what it teaches. And I know I thought
No,
to
it's
myself,
cute.
well, she's going to laugh at me when I
No, no, I
say
think
this.
it's a great movie.
But what it teaches, children and us adults. So I would say those are two, and then of course I'm a goofy girl, just like with my son and daughter. We're Marvel junkies, Star Wars junkies,
Yeah,
Lord of the Rings junkies. So
absolutely. Yeah, yeah. Those are fun. Those are really fun. How about podcasts?
so Optimal Living Daily is a podcast actually that I came upon it when I was struggling to kind of make sense of where I go professionally and personally as I was trying to figure out about the next steps about 3 years ago. So, and what I like about it is, it's very short, it's very simple. It's like, try this, like keeping a gratitude journal or whatever. It wasn't something that I had to listen to, um, that I didn't have to listen for a long time, but I could every day get something out of that. Um, there and the other one is it's a meditation one, and I'm drawing a blank on that. But when I walk, just because I am one of those people, if I am stressing, and I think maybe most of us do that, which really hurts our, blood pressure and heart rate, I will hold my breath. So actually, this one just helps me breathe.
Mhm.
It just, 3 in, 4 out. So it will just do that. Um, those are really the two that again, I would love to have time to listen to a lot of podcasts. My daughter, she is constantly, and she learns so much from them. But the Good Life Project is another one that I do when I have time. Listen to.
Perfect. I'm writing all those out because now people's like, I'm learning as well as I go. So it's pretty good. Excellent. What is one question that you wish I should ask you, and will you have answer it?
I think without asking, really, you and I touched upon it. It is really to think about, what does healing look like? We talked about the sleepless nights, the fear, anxiety, and really the big word is stress. So as I was doing this course with anti-aging and regenerative medicine, every disease state that we touched upon, the number one thing that we had to get rid of was stress. The number one problem. Well, we can't do that. Life is stress, right? Going to work. But what really I learned is that, and I guess that would be the question, how do you get rid of stress?
Mhm.
But the answer is, we can't get rid of stress. Stress is part of being out there and living the life. But then what do we do to kind of mitigate that once you know, have your moment? I'm one of those people that if I'm stressed, and I hold on to the stress and I think about the next, like everything, a little thing becomes really big. But that being said, when you have something like a cancer diagnosis, that's a big thing.
Mhm.
So we have to be able to acknowledge that and sit with it, grieve, do the process. But then how do we get to that healing part? How do we get to the other side? So I think we touched upon it. You kind of did, but that was the question that I would say directly. Yeah.
Excellent, excellent. Um, One thing I wanted to ask you as well is it's a lot of controversy, right, with estrogen, progesterone. So a lot of patients ask me, okay, I really don't want to do hormone blockers because all these secondary effects, I rather just run the risk of another recurrence versus just really having all these secondary effects. What is your advice in general about, again, I know that you've been great like with supplements and things like that, and it's case by case, but is anything in particular you have an advice for them?
What I would say is each of us, we have to look at the fact that we are an individual in ourselves. And there is a lot of information out there with data studies with hormone blockers and breast cancer or prostate cancer, early detection versus later on. We have to ourselves do the research. Now, I love to do that. I know not everybody, that's what they like to do, but going and looking for what information, and I don't mean Google, I mean NIH, National Health Institute. There is a lot of information to be had there, studies that have been done, studies that are ongoing, both with chemotherapeutic agents, how to dose chemotherapeutic agents, hormone blockers, nutraceuticals and supplements. So get as much information, because it's hard to get all the information because that's a lot of, and I don't even know, that's, and talk to different healthcare providers, your PT, good source of information, your pharmacist, if they have time, and, pharmacists are a very good source of information. If they look like they're too busy to, for you to ask them when it's a good time to reach out. It is something actually today. I had one of my new patients today was a breast cancer survivor, and for 20 years, and she came to me. I thought she was crying when she called me last week. She just said, I wanted, I don't feel right. I want someone to help. So getting all that, getting as much information, and then finding a village to help you. It's not about just your oncologist or, just a pharmacist, just anybody. Find your village and let your village help you in the healing.
That's super. That's a great way to finish our podcast. Great advice. And yes, so it's not like, for our audience out there, they're not by themselves. They're not alone. It is really great support groups, but sometimes, again, just find a good source of information. Sometimes a lot of support groups is all about the bad things and the bad things that happened to them, and the surgery didn't go well or the chemo didn't go well. Right. But there is so many good things out there that you can really learn and kind of make this journey as easy as possible with the best quality of life possible that they can be. So, Reena, thank you so much for doing this. I really appreciate it. I'm sure the audience is gonna love all the information and education that you just gave them. So I really appreciate it.
Thank you. And thank you for the work you're doing. This is awesome.
Thank you. Thank you so much.
All right.